I'm going to kick off the recording. Thank you all so much for joining. I'm so excited to be here with Dr. Ressler today. We have an incredible agenda, which we're going to try our best to pack into just 30 minutes. Hi, Dr. Ressler. Thanks for
Hi,
joining.
thanks for having me.
How are you doing today?
Doing well, thanks. Thanks. How are you?
Good. I'm really excited for this conversation. So, I'm Angela, the CEO and co-founder of Sunfish. We're a partner to Illume, and I'm joined here by Dr. Ressler, who's a double board certified reproductive endocrinologist at Illume Fertility, which has offices in Connecticut and New York. I'm going to start with a couple introductions while folks trickle in, and then I'll pass it over to Dr. Ressler, who will be talking us through what to know about the male role in fertility. So let me share my screen here. And just as we kick off, I wanted to remind everyone of a few housekeeping items as well. So hopefully everyone can see my screen here. All right. Um, let's see. How's that? Everyone can see that? Okay, perfect. So before I get into introductions, just wanted to remind everyone you are on mute automatically. You can chat to us on the bottom of the Zoom link here. There's a little chat feature. Only we will see that. So feel free to send us any questions. We'll answer them throughout the presentation and leave time for Q&A at the end. And like I said, we have a really exciting agenda today. We're going to talk about male factor and the male role in fertility, what that means, how you can treat that, ways in which your partner can support, and general expert advice from Dr. Ressler. I will also share a little bit about Sunfish and how we support the fertility journey as well. So, before I get to our main speaker, Dr. Ressler, I'll introduce myself. I am the CEO of Sunfish. We're a company focused on financial access, logistical, and emotional support for people going through fertility journeys. And I previously worked as a director at the largest surrogacy agency and egg bank in the world, helped a lot of people go through third-party journeys, also helped build out a previous financial platform called Origin. And I'm really passionate about making the process easier and more affordable for people, not only through my work, helping hundreds of people, thousands of people now around the world to navigate their journey, but personally, I've also gone through 4 egg retrievals. So I know it's a really tough journey, and our whole mission, everyone here at the Sunfish team, is here because we want to make this more affordable and easier for people. Um, and I'm really excited to have Dr. Ressler here with me today. She is a double board certified reproductive endocrinologist who started her career at Duke University, then completed her residency at the University of Chicago, and now lives in the New York, Connecticut area where she's been with Illume for almost a decade. Illume's a really incredible clinic. We at Sunfish are quite selective about the clinics we work with. So we've been really excited to collaborate with your clinic, Dr. Ressler. And fun fact, she's also got 2 really big dogs and is a Cleveland sports fan. So if any of you out here want to talk Cleveland sports after the webinar, this is the place to do it. I'm also a dog mom myself, so I love hearing about dogs. But yeah, I would love if you'd like to add anything else to that, Dr. Ressler.
No, that's a great introduction. I'm really excited to be here, from Illume Fertility, and really also excited about the collaboration with Sunfish. It's a really nice partnership that we're excited to be a part of.
Thank you so much. All right. Well, with that, would love to pass it off to you. As we get started, would love to just hear a little bit about what male factor means and what we're going to be talking about today.
Sure. Well, I'm really excited to discuss this topic. It's not maybe talked about as much as focusing on the female, but really it's like each is half of the equation, right? And in terms of timing, right, November is male like health awareness month, national awareness month. So it's really
Hmm.
timing to be discussing and this topic. So when we think about like how common is it when a couple is going through infertility that it's due to like female origin or male origin, about a third of the time it might be due to the female, about a third of the time to the male, the other third it could be a combination or they're not like mutually exclusive. And about 10 to 15% of the time it might be unexplained, meaning we have like a limited number of tests to evaluate this really complex process. Like reproduction is really complex. It's very inefficient, like at baseline. But we have some tests to do for both the male and the female. And most of the time, we do get some more information through that testing in regards to why they're experiencing infertility. But some of the time, all the tests might come back normal. It doesn't mean that there's not an underlying issue. We just might not have the right test to detect exactly what that is. And I just want to add one quick note just for, clarity that like what is infertility, right? We're talking about it and how we
Mm.
evaluate and treat it, but I think it's important just to at baseline know like infertility is defined like when a couple is trying to conceive and unsuccessful after 12 months of trying, or if a woman is 35 or older, we say after 6 months of trying to come and see us because we know that age in particular of the female is, has a big effect on fertility.
Okay, yeah, that's a very good point. I appreciate you flagging that. So, with that, why don't we dive into a little bit of an overview about how common is male factor infertility and what it actually means?
Yeah, so again, it occurs as the, male factors alone is the cause of infertility in about 20 to 30% of couples. And really the way in which we evaluate it is through a semen analysis. So it's pretty straightforward. Semen sample is collected in a sterile cup. Basically, patients can collect at home and bring it in within a certain amount of time to our clinic, or we have like private production rooms in each of our locations where the sample can be produced. And then we analyze it. We have experts in to do this test. They're referred to as andrologists. So it's important to do a semen analysis specifically at a fertility clinic. There are some like Quest or LabCorp type of evaluations out there, but these are not done by humans who are trained to do this evaluation. So it is important to find a fertility clinic to do this evaluation. And again, a combination of humans and machine do the analysis to look for really three key factors. One is the concentration, how many million per milliliter. So if you look at this diagram, like right there in the middle, the sperm count, that's what that's referring to. So the top like green bubbles are the normal, representing normal, and below abnormal. So that we like to see above a certain number, certain concentration. If it's below that, that would be considered low. And then to the right of that, you see it's commenting on motility. So it's evaluated like what percentage of the sperm are motile, meaning like moving in a meaningful, like forward progression. So we like above like 40% to be normal in terms of motility. And then morphology, how many are normal in shape? So if you look at like the top part of this image, you can see on the left there is a normal shape of sperm. So sperm is composed basically of a head, neck, and tail. And the abnormal can have like an abnormality with any one of these parts. It can have two heads, it can have two tails, there can be an abnormality with the neck. So for a semen analysis to be considered within normal limits, we only need like at least more than 4% to be normal forms. So if you think about that, like 95% could be abnormal, but it's still considered to be a result within normal limits.
Perfect. Okay, that's a really helpful overview. So, let's talk a little bit more about what can cause infertility and after that, some of the testing that can be done for couples.
Sure. So in terms of like causes of malfactor infertility, this can be discussed and broken down in many ways. In general, there, can be reasons pertaining to hormones. There can be anatomic causes. There can be genetic causes. So we do the semen analysis If any of those parameters are abnormal in any like meaningful manner, we would repeat the semen analysis because the life cycle of sperm is close to 3 months from the time it starts to be produced to the time it's ejaculated. It's close to 3 months. So we want a second look at it, right? Because we don't know, was that initial one like a good day, a bad day? We want a little bit more of a sense of an average. So we would repeat the semen analysis. If there are persistent abnormalities, then we would recommend further evaluation, like why are these parameters abnormal and can anything be done to improve them? So that type of like deeper dive into the evaluation is typically done by a reproductive urologist. So we, for example, work with certain reproductive urologists. There are not many out there. There are many urologists out there, but there are very few who are like fellowship trained in reproductive medicine. So we would point a patient in that right direction to have further evaluation. So blood work would be done, physical exam, an ultrasound likely, and other potential testing depending on what the scenario is to get more information. So for example, if it's a hormonal issue, there could be pharmacologic, intervention that could be done to improve parameters. If it's an anatomic one, sometimes different types of surgery. Um, and then there's an extreme situation, right, which does happen where there's no sperm detected. This is something called azospermia. And that it could be either that sperm just isn't being produced and there's none there, unfortunately, to utilize, or it could be being produced and it's just not able to be transported out. That's called like an obstructive cause, right? And so sometimes there's like a surgery that can be done by a urologist to extract the sperm for use with IVF. So those are, the ways in which we like further evaluate it. Um, the slide in front of us is just touching more on factors, many of which are, well, some of which I should say we can control, others not, right? But lifestyle habits, for example, can have an influence, right? So good nutrition, well-rounded diet, routine exercise, good sleep habits, keeping stress as low as we can, minimal alcohol, avoiding tobacco, avoiding drug use, like all of these things have been shown to affect sperm health and quality. In particular, use of androgenic steroids, even like testosterone supplementation, actually is harmful to sperm production. So be very careful about any like supplements. You'll want to run it by a fertility doctor. Before, starting any sort of supplements.
Fantastic. This is a really helpful overview, Dr. Ressler. So, we talked a little bit about lifestyle, ways in which you can put your best foot forward. If you do need to seek treatment, would love for you to share a little bit about what treatment looks like at a clinic like yours. And then I'll just call out, we've gotten a few questions. I'll get to those right after these two slides, too.
Sure, sure. Um, so in general, with fertility treatments, there are like two main categories. One is called ovulation induction, typically combined with IUI, intrauterine insemination, and the other is in vitro fertilization or IVF. So with IUI, this is a great treatment for like a mild malfactor, right? So let's say there's some mild issues with the concentration or the motility, but there's another parameter we look at. It's called total motile count. It's like a combination of the volume, the concentration, the motility. So if the total motile count is above a certain number, IUIs can be successful. So that involves getting a sample of the semen. It's washed, it's concentrated, so the best ones are available, and then it's in a little syringe, as seen here, attached to a small catheter, and the catheter is placed in the uterus, and it's timed, of course, very precisely with ovulation. So that is the ovulation induction part I mentioned earlier. We often like give a medicine to help not only one egg, but maybe like two or three eggs to develop in a cycle. We track that and we time ovulation and the IUI accordingly, very precisely. So it's getting, again, the sperm closer to the eggs at the right time. But in general, this is still like limited chance of success. So even in like a gold standard perfect scenario where a woman's under 35, good uterus, good tubes, good sperm, this works up to maybe about 20% per cycle. So it often takes more than one try to achieve that success. So we don't, typically give up after one try. We try a few times typically. But studies show that cumulative success, like kind of plateaus after three cycles. And so we would often move to IVF at that point, if not starting with that initially. So IVF would be, if you want to go to the next slide there, would be really best for those with more severe malfactor who aren't candidates for IUI or for other reasons, advanced, more maternal age, or if the tubes are blocked, or um, other reasons. So this actually is the best way to overcome malfactor because we can utilize a technique called ICSI to inseminate the egg. So there are two main ways so with IVF, the ovaries are stimulated to make many eggs develop. We ultimately take them out of the body with a procedure called an egg retrieval. And again, two methods to combine them. But with a male factor, we would hand pick so that the embryologist literally sort through, identify a normal looking sperm, hand pick it, and inject it directly into the egg. So this is physically putting them together. It's still up to nature for it to fertilize, but it's like maximizing the chance of fertilization. So IVF in general is our highest chance of success for, again, that kind of gold standard scenario for we create like a chromosomally healthy embryo. Upon transfer, it's more like 60 to 70% chance of live birth per transfer, so substantially higher.
Okay, great. So we did get a couple questions come in. Let me try to address them. We talked a little bit about causes, and someone's asking you, Dr. Ressler, how does a urologist go about finding a cause, um, with a little more information around what they're going through with their urologist? But they're wondering on any next steps you might recommend.
Yeah, so again, a basic, excuse me, initial evaluation from a urologist would involve, first of all, just a consult, right? Reviewing medical history, surgical history, medications, social history, habits, like I talked about in terms of like alcohol, smoking, and so on. So it would first be like a conversation with the urologist. Then, if it's typically done in person, a physical exam to follow. And then blood work is looking at, again, various like hormones, some genetics in terms of sometimes, especially when it's a more severe factor, looking at the karyotype, like the map of the chromosomes of the individual, as well as there are other certain genetic conditions. For example, like cystic fibrosis has an association with a particular malfactor infertility. So there's some genetically related testing that's done. There is other testing that is sometimes considered in more specific situations, for example, like sperm DNA fragmentation testing. This is not part of a routine workup at this point. But for those who have, for example, if a couple has like recurrent pregnancy loss or recurrent implantation failure or poor blastocyst development, like there are different causes for other like tangential testing to be done as well.
Okay, fantastic. And a couple more questions came in. So, when you go through testing, one of the things that they'll tell a man is sperm count and motility. So this person wrote in to ask you, at what point would you recommend IVF? I'm sure there's a lot of factors here, but if they went in, they saw 2 million sperm count, 2% motility, um, is this something that would be a good candidate for IVF? And they also want to know if there's an opportunity and by how much do you think some of the lifestyle factors that you mentioned can actually cause a change in sperm health? We talked about supplements, we talked about some of the lifestyle changes. So just any advice you can share, just kind of generally.
Sure. So in terms of like who is a candidate for like IUI versus IVF, you're right, Angela, there are like several factors. It's not only about one test result. So Typically, as I mentioned at the beginning, we go through, a whole female evaluation as well as the male evaluation, like in parallel. And we want to like get all of the information, all the reproductive checkup, as I like to call it, at the start, so we know what information, relevant information from the beginning. So again, the total motile count in relation to the semen analysis, that particular parameter does help guide us whether someone is a candidate for an IUI versus not. So if the total motile count is under 5 million, for example, most of the time an IUI unfortunately won't be successful. So it probably makes sense to go right to IVF in those cases. Um, and then in terms of like lifestyle factors, like how much they can improve, um, this is kind of a generic answer, but it really does depend on the situation. Like, I think that, especially if there's been like anabolic steroids that have been used, that I've seen a patient have zero sperm on a semen analysis, eliminate that, medication, and conceive then naturally. So there can be drastic changes, but look, getting a few extra hours of sleep, is that really going to change, the sperm parameters that much? Probably not. But I do believe just in general, as we do at Illume, like looking at the big picture is important. Like it's easy for us to just focus on the medicine and say, okay, you need to do this treatment, you need to take this medicine and so on. But like, we want to treat the whole person, and it's important to be paying attention to nutrition. We have two dietitians in as part of our practice who our patients can consult with. Both the men and the women can work with them. We have acupuncturists, stress reduction, exercise. Like these are all, I think, important factors.
Yeah, and it's so hard because it really is so case by case. But we do have some good news I'll share at the end of this around some discounts and options to help you get started. Two more quick questions for you. I wanted to know, what is your number one advice for how partners can be more involved in this process? If you are with someone who has male factor infertility or just going through IVF and a family building journey in general, what's your number one advice?
Sure. I would say, just be present as much as you can and supportive. It is often, more challenging for the men in the sense that they um, are not necessarily always the active participants, so to speak. Like a lot of the more involved testing pertains to the female. The treatments, whether the underlying cause is male or female, in an IVF cycle, right? It's the woman who's taking the injections daily and coming in for the visits and having the procedure and so on. So it can be hard to, stand by and watch that. But I would say be as involved as you want to be. We have many male partners who attend the consults, who come in for the monitoring appointments, who help mix and administer the medications. So there are various ways. I think each couple is unique and can find what works for them. But I would say just to be, present and supportive as much as possible.
Thank you. All right. And then what is your number one advice for couples who are starting on this journey?
I would say, in terms of starting this journey, is to, I'll say, for lack of a better way, like don't waste time. Like come in, and if you have any question at all, that whether, you truly do have infertility or not, or could there be something, a male factor or a female factor, whatever it is, I would say, time unfortunately is not on the side of fertility. And we see many people, unfortunately, with regret, wishing they had done things earlier. Again, the age of the man is does not have as big of an effect. Age affects men much more subtly and starting later on because men are continuously making new sperm throughout their lives. They don't like have a set supply as opposed to women, right? We were born with a set supply of eggs, and that's all we get for our lifetime, and they're only going down in number. And once they're gone, they're gone. And even before they're gone, right, which is menopause, average age 51 in the US, starting in our mid 30s, that's when these effects start to take place. So I would say, come see us sooner rather than later.
That's fantastic advice. I will share my screen one more time because I did want to. How's that? Can you see that? Okay. I did want to talk a little bit about my number one piece of advice if someone's looking for a way to get started, which is to come to our company, Sunfish. We offer an all-inclusive IVF bundle with a partial money back guarantee and full support on your journey. So if you are looking to start this process, our company works very closely with a number of clinics around the country, including yours. Anyone who's interested can come to us, get a personalized IVF package. It's one flat fee, all included, and it includes a money back guarantee if you don't go home with a baby. So we're going to be supporting you all the way from initial testing, that initial consult, until you go home with a baby with financial support, including loans, lines of credit, uh, unlimited transfers as you go through the IVF process, discounts and digital guidance, emotional support. We offer discounts and partnerships with mental health professionals and a dedicated coordinator on the Sunfish team that's going to be your financial advocate, making sure everything goes smoothly, getting you discounts on medications and more throughout the process. And we even send care packages throughout the way. So if you are looking for an easier way to start IVF or even just learn about the process, our team is here to help. And we've been really excited to see the great feedback we get from patients at Illume and at clinics all over the country who feel really supported and just have that extra resource, extra information as they go through this process. And of course, the financial protection to help get started. Sometimes the initial testing and exams may be covered by your insurance, which is great, but then the IVF cycle is not. So that's a big part where we come in. If you don't have full coverage for this process, even if you have some coverage or if you have an employment reimbursement, like certain employers will reimburse you for costs, or you're not fully covered, then this is the right option or a great place to get started because we're going to be there to support you, make sure you're getting the best prices, make sure we cover you and protect you with unlimited transfers and a money back guarantee if you're not successful. Um, so we were able to go through a lot of the questions already, which is fantastic. Oh, let me go to how to contact us. Any final advice before we give folks a discount code and let them know how to get started?
Um, Yes, I would say, first of all, it's amazing, what you just mentioned, what the company offers, because I will say, like, there's so much, this kind of ties into my advice. There's so much stress surrounding this process. It can be like the most stressful time in a patient's life, really. And so finances are often like a cause of that. It can contribute. I always say like you have to kind of look at the medical, the emotional, and the financial aspects, and they all have to kind of align. So it's great to offer, this support in the financial end of things, and that, again, tying into my advice would be like you and I can only control so much of this, right? Like everyone here is has the same goal to, help people grow their families and to have a healthy baby. And we are all rooting for you and on your side. But this is like a process, it's a journey. And I always say I wish I had a crystal ball that could tell you exactly like how and when this will happen. I definitely lack those powers, but just to have, trust in who you're working with and to voice your concerns and frustrations. And, we do want to hear it, both the good and the bad. And we're here, everyone on the same side.
That's great advice. And I would just echo that and kind of build on that to say, find your support system. This is a really hard process. Like I said at the beginning, I've been through it too. So whether that's friends, family, folks you can reach out to, and of course, we Sunfish would be honored to be one part of your support system too. That's really what we're here for, to help with everything outside of the four walls of the fertility clinic. Do you have any thoughts on who the right folks are for the Sunfish program? Most doctors kind of say anyone who doesn't have full coverage, but curious if you have any further advice.
Yeah, I mean, I would say that is definitely the case. It depends largely, often insurance coverage on what state someone lives in. There are oftentimes like a finite amount of coverage. So sometimes people might start out with coverage, but unfortunately, go through it. So I think for sure one without the benefits or coverage, it's a great idea to look into it.
Great. All right. So let's just wrap up with how people can contact us. So, good news if you've registered for this webinar, you get some savings on your first consult with Illume and with your Sunfish personalized package. So, $100 off each. If you're interested in getting started with Illume or just learning more, you can email appointments at illumefertility.com. And there's also a really comprehensive resource on the Illume website that you can check out. If you're interested in getting help in any questions whatsoever, feel free to reach out to us. You can call or text us at this number at Sunfish or email us. And of course, follow us on social media for more information and for clips of this webinar. We'll be sending this out to everyone. But with that, I just want to thank everyone for joining and for your interactive questions. We got a lot of comments from people listening in. So thank you for everyone who's been chatting in your questions. And especially a big thank you to you, Dr. Ressler. This was such a helpful and informative topic. And I know we barely scratched the surface, so I hope people will be able to continue their journeys beyond this. But thank you for sharing all your wisdom.
You're welcome. Thank you so much for having me.
All right, have a good night, everyone.
Bye.